The broadcast is now starting. All attendees are in listen-only mode.
We'd like to welcome everybody to our webinar today. It's just a little bit before 4 o'clock Eastern time, and we're going to start right at the top of the hour. So hang tight for another minute and we'll be starting right away.
Good afternoon, everyone. We will just get started here in a minute. We have a few folks still logging on. We'll get started here in just a minute. Good afternoon, everyone, and thank you and welcome to the COVID-19 Health Data Users Group Kickoff meeting. My name is Candace Talkington, and I will be your facilitator today. I am joined today by Norman Thurston and Charles Hawley with the National Association of Health Data Organizations, along with my colleagues Shuli Jarovich and Alex Bohl with Mathematica. Today, we're going to take an opportunity to look back over a couple of topics that have been shared, along with some survey information that was captured during those previous events. But today's focus is really going to be on understanding how COVID-19 has impacted your life and ways we might support you. Today, we want to understand the types of data sources that you're using and perhaps hear from you on challenges that you're facing as you're accessing those data. We'd also like to hear from you on topics that we might cover in former sessions, as well as resources that we might provide for you. We're going to take a moment to share some of the resources that we've begun to put together for you. And then we'll wrap up with next steps. And those next steps are really largely going to depend on what we hear from you today. This next hour is really designed to be interactive. So we're hoping to hear from you. We've opened up the chat line. You're welcome to type in any ideas that you have, share any thoughts that you have. You'll have an opportunity also to participate in several polls. We also have a questions feature. The questions feature, if you have a specific question, we have a moderator who's monitoring those questions and we'll answer those as well. So with that, I am going to turn it over to Norm, who's going to share a little bit about the previous topics that we've shared, as well as give you some more detail about the background and the goals for today's session. Norm?
Thank you, Candace. So my name is Norm Thurston. I am the Executive Director of the National Association of Health Data Organizations, and we're pleased to partner today with Mathematica to launch what we hope will be a very useful data users group for those of you who are involved in using data to examine the impact of COVID-19, whether that's guiding the response or on hospital systems or whatever your ballpark is. We want to create a platform and environment for data users to come together and talk about how this data can be helpful. We did a mini web conference a couple weeks ago talking specifically about COVID-19, and we asked the attendees what they would like to see covered in more depth. And we've put those survey results on the screen. And I think these are telling important data for us to understand what it is that users might be interested in. The number one answer was how to use hospital discharge data. We did a follow-up webinar after the main webinar that addressed that partially, but I think there's a lot more ground to cover when it comes to using hospital discharge data. We also note some of the other topics here that I think are critical for us understanding going forward. How to identify a COVID-19 related episode. How would you ever find that in the data? What are the hallmarks? What are the markers? What are the data traces? And I think that's something that we do. It's an unanswered question. I don't think we know how those episodes are going to be coded, so we don't know how to find them, but it's something that we, working together as data users, can figure out. Another issue that is important to recognize is that there's a lag in generating administrative data. It takes time for episodes to turn into claims and times for claims and episodes to turn into data in a database, and furthermore, time for that data to be processed and available. So what are people figuring out? What are we learning? How are we able to address that? We are pretty confident that that lag will not be a fatal flaw, that there are ways of using the data for many, many applications. It's probably not the best source of data if you're going to be doing real-time tracking. There are other ways of doing that, but there are lots of things that can't be learned that way. And so they're having administrative data, hospital data, claims data, having those available to decision makers will be real important. You can see the rest of the questions there. These are some of the data uses, impact on hospitals, how to use claims data. Telehealth, that's something that I think many of us have been advocating for a very long time and would like to see more telehealth. Well, this all of a sudden gave us an excuse to use telehealth, and here it is. And we can look and see how that comes up. There are also some other sort of peripheral issues that maybe are interesting, such as behavioral health or impact on Medicaid growth and enrollment. As you look at people who are now unemployed or who've lost their jobs and their income has gone down, what's going to happen to Medicaid enrollment? What's going to happen to Medicaid planning going forward in the future? But just to summarize, why are we here today? We're here for you, for the data users. We want to create, by the end of this 1 hour session, we want to create the next steps for having you have an opportunity to communicate with each other, to get your questions answered, and to answer other people's questions. And if we have questions that nobody knows the answer for, that we can go out and find people who can answer those questions. And so we're appreciative again of Mathematica being willing to partner with us and bringing this idea forward. And we're going to be talking about some of the resources that they've already committed to making this happen. But during the session today, we're going to be focused on what are your needs and how those needs can be addressed as users of healthcare data to address COVID-19 pandemic. And with that, I'm going to turn the time back to Candace. And I think we're going to take some time to do some polls and learn more specifically about you.
Thank you, Norm. Yes, as Norm mentioned, we are going to have a series of polls. And so we'll start the first 3 set of polls. It's designed really to help understand who's on the call, who's participating, and more specifically, how COVID-19 has really impacted your life. So with that, I'm going to launch this first poll. Let me actually turn that. And all right. Norm, can we see the poll? Can everyone see the poll?
No, let me go ahead and try and launch it from my screen, see what happens here.
Oh, here.
There we go.
All right, there we go.
There we go.
Now we should be, okay, thank you. All right, so some of you might be wearing multiple hats. Totally understand that. What we're asking you to do here is select one, the one that most closely describes your daily work. Okay, and several of you are still responding. Give it a few more minutes to let you all finish your poll responses. We may not have captured your job title, and if that's correct, feel free to type in something that might describe better in the chat function under the chat, and we'll capture that information there. Okay, it looks like we slowed down, so I'll go ahead and close that, and I'll show you all the results. So it looks like most of you are in the director or manager role or data analyst. Okay, that's really helpful. Thank you so much for sharing that. We're going to move on to the next poll, and this is more asking about how COVID-19 has changed your personal daily routine. I think many of you may be experiencing changes. Some of you may be used to working at home. Others of you not so much. Let's see, Paul. Okay, launching the second poll. So we really just want to understand how COVID-19 is affecting your ability to do the work. On this one, you may have many things that are being impacted, so select as many that apply to you. Again, we may not have captured something that's really affecting your life, and in that case, if you have sort of an other to add, feel free to type that into the chat as well. Okay. Many of you are still voting, and I will close it here in just a few seconds. Okay. All right, I'm closing it up. And it looks like most of you are working from home, as I might expect.
Almost
balancing
everybody.
responsibilities. Yes, almost everybody. Thank you. Yes. Just about half of you and about a third of you are coordinating with someone else who's also working from home. I can appreciate that. Balancing family responsibilities. Certainly a new thing for many of us. Some of you might be used to working from home, but this is a new thing for many of you. So thank you for participating in that poll. We have one more poll for you in this session, and then we're going to pause for some discussion. Because all of you are on mute and there's so many of you, we really are hoping that you're going to participate in the chat during the discussion session and post your questions. So the third poll in this section is to ask, what is it that you're doing related to COVID? What specifically is your job function? Let's see. Good. And here's the poll. Some of you might be tracking and monitoring COVID-19 data. Some of you are planners and working on projections. Some of you are providing data to other users working on projects. Again, here, if we've not captured something that you're doing related to COVID-19, feel free to type that information into the chat as well. All right, I'm going to give this a few more seconds as many of you are still voting.
And don't forget to click on the submit button, by the way, if you haven't already.
Thank you, Norm. Okay, it looks like we've slowed down, so I'm going to go ahead and close the poll and share with you all the results. So just about 3/4 of you looks like you're providing data for other users working on information. About a third of you tracking and monitoring, planning and projections, and sharing workflows. Great. Or I'm sorry, changing workflows. It's really helpful. Let's see if we have what we have in the chat. I don't see anything in the chat. Okay. All right, so we'll close that up. And so that opens up some of the discussion. So we're really hoping to hear from you in the chat. Oops. Let me close this out. There we go. All right. So this was a discussion. So speaking of the impact of COVID and how this has impacted your life and your work, many of you talked about how this has affected your daily routine. More specifically, wanted to know how working from home has affected your ability to access the information that you need. Many of you are used to having immediate access to things in an office setting, but working from home could pose some of those challenges. We'd like to hear from you how some of those challenges are impacting your life and what specifically the systems that you're unable to access. If you could type that in the chat, and we'll see what we can do. There we go. Anybody willing to share how this has impacted their work and access to systems?
This is Norm. One of my particular questions for people to help us understand is how many of you who've been completely reassigned to something that you didn't do before because of COVID-19? That's one question, and maybe discuss about what that's like for you. And then the second question that I have for you is, in part of your normal work where you would be informing other public health issues or issues like this, how has the topic of COVID-19 affected the way you're thinking about what you were doing before? So if you're involved in data collecting or whatever, has this now caused you to rethink different things? And by the way, I've been asked to just clarify the difference between questions and chat. Questions is a place to ask questions, and chat is a place to make comments. So if you can't find it, that's a good question. We did have a question there about where that is. And let me see if I can explain that to you because I see the management screen here.
So Norm, this is Trudy. Welcome everyone. So I wanted to, I think chat versus the questions, we could see both of them, and I'm looking at the questions. Maybe as you're thinking about the questions, I think a few responses on the other. There is another dimension to change in the way that we work is, you know, stopping travel to clients. So that was another point that was made on the polls, and looking through the others. The topics are policy and emergency regulations and guidelines that was brought up. And then we do have a few consultants who are working with the local health departments and hospitals among us. I wanted to point out we have 100 plus participants in the webinar. We do appreciate your time. And the vision of this forum and future is to kind of collectively think about what we need and what would make sense for us to collectively think and share resources, as well as support each other in this new work environment where a lot of us are now working from home for the first time. As pointed out in the poll, a lot of us are dealing with multiple challenges with working with families and others. So it is, you know, it is meant to have both the technical support as well as maybe sharing best practices around, you know, adapting to new environments that we all are finding in. So I wanted to put that out there as well, and that's why, you know, we ask the questions about how your life is changing as well as the technical issues that you are going to be working with the COVID-19.
Yes, and so we're discovering that many of you don't have access to the chat function, but many of you are using the question function, so that I think we'll just go there and we should be able to sort of relay some of the information. One of the questions is, can we have a copy of the slides? Yes. So we will definitely send out a copy of the slides. Norm, I don't know if you have access to the slides that you're able to send this out to the larger group now. So it looks like some of the folks wanted to use the slides to take notes. So one person mentioned that communication is different, and I wonder if I could ask the question and all of you could respond in the questions feature. A little different, but how has communication changed with your colleagues and with your clients as you're thinking about data? Many of us are using video chat and different things from the home, but how has that affected your ability to communicate with external folks and your clients? I'm reading here. So working with the team and writing analysis plans. I'm just reading some of these questions here. Looks like for some of you, there's been minimal impact on your ability to access some of the data. Minimal impact. I'm having a hard time reading some of the questions. It looks like I don't have access to all of the questions, Norm. If you're able to access some of the questions, perhaps you could relay what you're seeing that folks are typing in chat.
This is Charles. I noticed that one person called out that they've been told that they should not use Zoom. Somebody called out that they're just talking on the phone a lot more. There's some anticipation of delays, it sounds like, and even some changes in future planning for data collection specifically.
Yeah, and one of the things that I've noticed, there are a couple of questions here that have that talk about the relationship with clients. And so at least one person mentioned that they used to spend a lot of time out visiting with their clients in person, which is obviously not happening anymore. And another person mentioned that with some of the clients were in the middle of tasks such as needs assessment, but they've either been laid off, furloughed, or they've been pulled off of those assignments to work on direct response. So some of the projects that were kind of ongoing have just been put on hold as people are no longer working on those projects. Kind of everything's on the pause. See what else is on here. And by the way, just so that everybody's knows, it looks like that the attendees only have access to questions, not chat. And I've been trying to figure out how to turn that on, and I can't. So I'll keep working on that. But just keep putting your comments into questions. That'll be fine. We also had a comment here about we have to prioritize what revisions we can make for the fiscal year 2021 data collection. And we delayed a number of revisions until 2022. So people are not able to do some of the business as usual functions that you would want to do because of issues related to COVID-19. My role is focused on performance measurement in addition to anticipated delays in collecting data, which is also a concern for everybody, delays in actually getting the data. We're now trying to figure out how to make adjustments because the disruption is for sure going to impact the assessment of performance measures. And that's one of the thoughts that I think we all realized early on is that when clinics start going into crisis mode and healthcare systems are going into crisis mode, it changes fundamentally the nature of their business. And so if you were trying to get longitudinal data about their quality measures or their performance metrics, that's going to be affected. And we'll have to figure out as a group how to make that transition or how to work around that more likely than not. Let's see, people are commenting that a lot of Zoom and a
Oh, go
lot of
ahead.
emails, right? Well, everybody's using a lot of Zoom and emails and Skype, so a lot of meetings were canceled. These are sorts of things. So go ahead.
I know, it seems like overall, it seems like for this group at least, there's been minimal impact on the ability to communicate, though I'm seeing a lot in here where speeds have been slower trying to access data from a different location perhaps. So certainly that's sort of rising to the top as well.
I did
If there's
like
anyone,
one comment, Candice. It said, we are not physically together, but we are also closely connected by technology. So it seemed like true, either we are using Google, like different platforms, yet technologically we seem to be connecting more. And they mentioned meetings are canceled, yet we have more back-to-back meetings because of the technology as well.
yes. I think, we have a large number of people on the call, but I suspect some of you would feel more comfortable sort of talking through some of the questions that we're asking. We'd ask that if you would like to speak up or share, you can use the raise hand feature and we will unmute you and allow you to participate in the discussion through audio. Norm, perhaps you could give the audience some direction on where they might find the raise hand feature.
Question. It is enabled. Attendees can raise hands. Oh, there it is. So it's in your control panel. It's there should be a new button that just appeared for you to raise your hand. So if you want to join the conversation verbally or ask a question over the phone, that would be great.
And that button conveniently looks like a hand.
Yeah. And this should be on the far, well, it depends on where it's located. Mine is on the far right-hand side of the screen. There's an arrow, the sound button, the full screen mode button, and then a raise hand button. We've got more comments coming in the question bin. Yeah, so you do have to click that red arrow to be able to blow that out. It should be there.
So I had a red. Oops. I don't see a raised hand to unmute someone. So I think what I'll do is just move on to the next set of questions. I think we're going to dig a little bit deeper into some of the resources that we have set for you and hear a little bit from you about resources that are going to be helpful. So I'm going to move on. Again, if you would like to chat, feel free to raise your hand and we will unmute you. Continue to type your responses into the questions feature of your panel. So the next set of the next set of polls are really related to the resources, as I mentioned. The first poll is related to the types of data that you're accessing now. So I will launch that poll. Let me bring this back up. Okay. And what types of administrative data are you working with now? Again, we've given you 5 options here. If we have not hit the mark for you, please just type your responses into the questions feature. Looks like still most of you are responding. So far, hospital discharge data seems to be rising to the top as the most, but it is kind of balanced. You guys all have a few more seconds to respond. Okay, looks like most of you have responded. I'm going to go ahead and close that poll and share with you the results. So it looks like, again, as I mentioned, most of you are working with the hospital discharge data, inpatient, ED, ambulatory care. Many of you are also looking at all claims payer databases. The next up, Medicare, Medicaid, and eligibility and enrollment data. A few of you, about a quarter of you, are looking at pharmacy data. The next poll is, asking a little bit more about what types of data that you hope to capture. So we've asked you what kind of data you're accessing, but are there other data sources that you're really hoping to access? So let me go ahead and launch that poll. There we go. All right, what types of data do you hope to link to? We've given you 5 options here. If you do type other, feel free to put that into the questions box.
And Candace, if it's okay, Nicole Helvey has her hand raised. So while we're working on this, can we just go ahead and have her ask for a question or make a comment? Is that all right?
Hey, Norm, are you able to hear me?
Yes.
Hey, thank you so much. Actually, with the last poll, I was really curious with some of the other users online, how new their discharge data and their claims data is. That's something we're looking to try to get more timely data in the future, and I'm just curious how other states are, how frequently they're getting it.
That is a great question. I don't know how we're going to be able to do that on the fly, but if there's a way for those of you who are on the phone to kind of, or on the webinar, to let us know what's the frequency of the data that you're getting, that would be very interesting for us to know how fast that can happen and how fast it is happening. So if those of you who are data managers can just kind of type in the questions bar and just say, we're publishing on this turnaround, that would be very interesting.
Thanks, Norm. Yeah, just to put that into perspective, here in Florida, we collect the data quarterly, and there's a 5-month delay from the end of the quarter. So our discharge data has been very useful from a historical perspective in terms of migration across state and county lines, so we can try to anticipate hospital load and also some of the ventilator utilization and things like that. But to get real-time availability data or even close to that, I'm curious how others are doing that.
While we are collecting, this is Julia Gerovich from Mathematica. I used to be in Maryland collecting the hospital discharge data. And when I was there, we moved to a monthly submission schedule with a 1-month lag, and it was a continuous, like the claims processing. We updated the previous monthly submissions to get the better feed, but that transition took us about 6 months, like from planning to implementation. And then once we did it, now I think it's going smoothly to do on a monthly basis.
Yeah, and I can see here in the comments that Washington gets APCD data quarterly. Michigan, we get ADT data based on a continuous immediate basis. Brian reports that they usually get reports quarterly, but they're looking to report partial results as claims are submitted. Working with Medicare claims, we receive those monthly with about 2 months lag and consider even then the latest 2 months to be incomplete. That's from Daniel. In Wisconsin, WIO receives data monthly in the month following processing health plans and state Medicaid. At this point in the month, we receive files from all of our health plans for the claims they processed in March. We're planning on an early look for the impact of COVID in the next week or two. For Maine, we have the first quarter of 2020 available in July. Of course, that will be missing runout, so March will not quite be complete. Laura reports that they get daily and weekly Medicaid claims and encounters. It takes about 3 months to receive 90% of those records. So, and it looks like quarterly for Tennessee. Colorado is getting data monthly with 45-day processing. I think that's fairly typical, is that it's about a 90-day lag in terms of getting everything into the claim system and over. I think hospital discharge data is faster, but we're probably going to see at least a 30-day lag just getting the claims over. And then there's the processing lag on the outside, depending on the state and the system. Candace, you want to talk about those latest poll results?
Yeah, so thank you. And keep your comments coming. I really appreciate that. So it looks like most of you are identifying cases for COVID. Another large group of you are, monitoring mortality rates. About half of you are looking at provider locations for COVID-19 cases, and about 2/3 of you are area level population risk or hotspots. There were a few of you that typed in other. I suspect we captured that in some of the responses that Norm just read out. ADT for Medicaid enrollees, data for our emergency status systems and the health information exchange, lots of health information or health department data. Yeah, so lots of data, and which brings us to the next question. How can we help you? Let me close this one out.
By the way, there was a good question that just came in. Is anybody out there monitoring testing data? So of the people we have, that's an interesting question. Do we actually have people in this group who are involved with testing data?
There was an earlier comment about the lab testing and the challenge of incorporating or working with the labs. If that person is able and willing to speak, maybe he can speak to his experience.
Yeah, we'll need them to raise their hand. There's a hand. Let's see if I can. This has been a test of my skills today. That's Daniel. Hang on, Daniel. Let me unmute you real quick, and then Nicole's going to comment as well. So Daniel, go ahead.
Hi, can you hear me okay?
Yes.
Yes, so I work for a company called H-Metrics in Maryland in the HIE space there. And we've recently been tasked with standing up reports related to COVID in Maryland. And so one thing that we noticed is when we started getting these new data streams, specifically those from the labs, that the data were very far from uniform. We're coming from sort of the Medicare space and dealing with those claims data with all of the data dictionaries and everything else, where everything comes in completely standardized and as expected month on month on month. That when we started getting these data streams with very different formats, very different coding and the like there, that we've had to sort of take a step back and sort of come at implementing our solutions from a different angle. And I was wondering if anybody else could speak to the kinds of experiences that they've had working with lab data, because it's a very new space for us.
And Nicole has her hand raised. Let's go to Nicole and see, you either answer Daniel's question or create another one, and we'll have people type their answers in the chat box. Go ahead, Nicole.
I think that was a leftover hand raise from before,
Okay.
But we are also exploring this option of potentially grabbing the lab data. And one of the things that we're doing right now that's been pretty helpful for our folks over at the health department and the planners is we have through our HIE an event notification service where we're live streaming those ADTs out of all of the hospitals in the state. And during this time, normally we don't keep those. We pass them through to a subscriber list to alert them of their patients' hospital events. And we typically purge them after 72 hours. But when the emergency was declared, we put a stopper in the drain and started retaining them. And what we're able to do is through the MPI in our HIE, we can measure the discharge date against the admission date. And we're just now starting to be able to produce average length of stay by facility for our planners. So as we look at bed availability moving forward, we have all of our licensed facilities in the state are required to log on daily to our emergency status system and enter information about their bed availability, their current census, patients in ICU on ventilators, positive patients, things of that nature. And so, we've been feeding in now this average length of stay information to the models so that we can look at, hospital capacity moving forward based on how long a bed is going to be occupied. But one of the other things we would like to do with these alerts is we get these COVID-related alerts, and we're looking at a specific group of diagnosis codes that triggers this, is to pull them out to do an automatic query against the National eHealth Exchange for any existing CCD documents, continuity of care documents, and be able to push those to the health department or the treating providers through a gateway that we've just set up called Pulse, which allows providers and first responders a secure portal to log in and receive that clinical information, potentially on patients that are not familiar to them. We have 2 or 3 field hospitals that the National Guard has set up here in Florida already, and those are being staffed by National Guard personnel. They don't have an existing EHR. And so, with our elder population and persons with comorbid conditions being the most impacted by this disease, it's critically important that they be able to go and find any medical history information that might be available. And this is allowing them to do that. But what we want to do, back to that point, is get the lab feed from DOH, put that into our MPI, so that we can start proactively pushing that information to the treating provider rather than them having to log into a separate portal and query for it.
Thank you, Nicole. I don't see any more hands raised. Candace, back to you.
Oh, yeah. Before I launch this next poll, I wonder, and one of the topics that was listed in your survey at the beginning, Norm, was about telehealth. And I wondered if there was anybody on the call that's collecting anything related to telehealth data, or if that's something that you, as an organization, are interested in collecting specifically. Again, feel free to raise your hand or type it into the questions box if you have a response. I'll wait a moment before I launch the next poll.
So, Leanne, do you want to comment more? You'll be looking at telehealth data in the APCD. If you want to raise your hand, I can find you and unmute you. Or if you don't want to raise your hand, just leave it down. I'll never find you.
So we are getting a lot of comments. So if you are not reading yours, please accept our advanced apologies. One that I caught while looking at Leanne is apparently Michigan is also collecting lab data from physician organizations and payers. They haven't received the reports yet, but in the next day or two, they are going to start working on it. So that was from Jeannie.
And hi, this is Leanne Candor with HSRI. So yes, we're very interested in understanding the telehealth data. Now we know there are some very specific telehealth providers, but now a lot of providers are offering telehealth as a service through your regular practitioners. So we really want to understand kind of those shifts in the data, and this is also of special interest to us because we do a lot of work on transparency websites such as Compare Mean, and we're planning for the next update for this site, and things are going to look different of what sorts of procedures and that people will be looking for from that type of site, and understanding the cost differences through a telehealth visit versus a regular office visit, and really wanting to see how that's gonna play out over the next year. So we're really interested in trying to identify those different types of visits and the types of providers now offering telehealth, and how the costs vary.
Yeah, thanks for that. Expanding upon that, I think that's definitely top of mind for a lot of us. And so thanks for sharing that. It looks like, Jim, you also shared that your organization is receiving telehealth codes and tracking claims data. Daniel, it looks like, I don't know if you want to speak up, your tracking seems to be one of the best potential real-time data sources, which I think is absolutely true. I am going to go ahead and move on to the next poll so that we can move into more of the what can we do for you discussion. So as we think about the types of data that you're accessing, let's move into the discussion of what kind of data you hope to access. So I will launch that poll here for you all. Are you looking at identifying cases? Many of you already said that you're doing that, perhaps looking at mortality rates, looking at locations for 2019 cases. Many of you are already doing this, but for those of you who are not accessing it, what is it that you would hope to access? And you can choose as many as you like. If you have an other, feel free to type that into the questions box. And several of you are still voting. I will close in just a moment. Okay. I'm going to close it and I will share. And I'm realizing that I was reading something different than what you were seeing, so I apologize for that. So when asking what is it that we're looking for, most of you, it looks like, are looking for a webinar that features experts in data collection. You're also looking for a library of resources, which is exciting because we're going to share something with you here in just a moment. About half of you, a little over half of you, are looking for a way to connect through a forum. And we have some questions around that, so hopefully we'll get some information from you. And then a facilitated roundtable discussion also seems like is of interest to some of you. So with that, I will move it into the discussion portion, and I'm going to turn it over to Shulay and Alex to share a little bit about what we've begun to put together for you and get some feedback on how we might move forward and help you.
Well, I'm glad. So this is. Can you hear me?
Yes.
Yeah.
Okay. So I'm glad that the Library of Resources kind of got quite a bit of responses, and this was initiated with Norm's initial question to us to say, gosh, what data sources available right now to do COVID-19 analysis? And when you look at the web, when you get newsletters, information, there's a lot out there in a rapidly changing environment. So our attempt to help the people like you who are busy is to provide you with a library where these are curated, sorted in a meaningful way, and ready for you to take a look and see if any of them would be more useful for you. So we designed 2 different websites. So the first one with the nice picture is and the deadly picture is more oriented towards the policymakers and the managers, and organized by topics. So looking at these different topics, you can go into the detail and see the list that we are creating on a weekly basis and updating it. And on the right side, what you have is the more analyses and data scientist work, where we are tracing the main sources of that data to the outcome. So you'll see in the green, the tracking reports and where the main data sources are coming from. And Alex is going to talk to you more about like how that side can be utilized to download the data quickly and then using for your own analyses and expanding on the models that they are already developing. And with that, Alex, you can take the next one.
Sure, thank you, Shulay. So this is, I'm now showing the tables that go behind these figures. We have 2, one would be resources and one would data source, and the other is data sources. Again, most of the information, or nearly all of it at this point, is the same between the GitHub site and the website, but over time, if there are more development tools or data sources that the group would like us to sort of bring locally or make more accessible, by locally I mean host on this site, GitHub provides us that flexibility to put code or data a little bit more easily. But right now it's the same thing. It also provides some sortable features, as well as we'll be adding more info over time at the aggregation level of these data, because each data set, as many people have probably found over time, especially things are really originating at states, of course, or counties or cities, and being aggregated up to a certain level. And while Johns Hopkins, going to the Johns Hopkins repository a couple weeks ago on March 27th, when we presented, was probably the best way to go. Now it seems like to a larger extent, New York Times data could give you more aggregate results. And if you wanted to not deal with, if you wanted to join those to your data or use them in some way and not deal with any changes in schema, it seems like both AWS and Google Cloud are both dealing with that now. So we're using the diagram from the previous slide to try to map and understand all the sources that feed into different dashboards, et cetera. And then over time, we can then recommend kind of the go-to sources if you want to link on certain types of data. The other thing to note too is right now, if you were to go to the resources page that we showed before, as well as here, we link to some coding guidelines, such as for ICD, CPT, HCPC, LOINC, and SNOMED. Of course, the coding guidelines are changing rapidly, and there was a lot of the best initial information came from that NODO call a few weeks ago on March 27th, and I think the call earlier that week. Right now we're building a primer for all these different value sets that could hopefully would support those using especially ICD, CPT, and HCPCs. Use their data and sort of use common definitions. In the first release that'll be posted on the website coming this week, it'll be focused most on the value sets for COVID-related conditions, be it exposure to COVID, COVID diagnosis, etc. The second will be on COVID-related services, and then the third will give a primer on how to link those to some of these other public websites, whether it's on social determinants of health, case counts, testing rates, etc., at different levels. So that was what's to come on both the GitHub and the site, but really right now it's showing very similar things. And so you can choose the source that you're most comfortable with, but right now the mathematica.org website is the preferred outlet for the getting information.
Thanks,
Thank you, Alex.
Go ahead,
I wanted to say, Candice, if you look at the website and if you have questions, please feel free to either reach out to me. There's also an email in our website that you could email, and they'll connect with either me or Alex or Candice. So these are, I'll call it a living web pages. We are constantly looking at it, trying to update them on a weekly basis and try to elevate the most useful or most widely used resources up top. Back to you, Candice.
Yeah, and Candice, if you don't mind, I actually have a question if we to put out to the group. So based on the most recent polls, of course, it looks like people are looking for a library of resources or also webinars featuring experts in data collection and analysis. And I think one of my colleagues on the chat pointed out maybe the value then is, of course, if you miss a webinar or learning, or you can then access those resources later. And so we'll try and make sure that everything is recorded and we can distribute. But one question would be on data collection and analysis. And again, if people could use the question function, if any, I know we've received certain questions already, but if anyone would be able to, basically put in questions of the types of analyses or types of data collection they want. We've heard about, how to collect data from labs, but are there any other data collection discussions that that we should focus on, or any kinds of analyses? We've heard performance measurement and quality measurement and how to account for that because of COVID. So if people could put in any questions, that would be helpful for future planning.
As you were thinking about responding to Alex, I'm going to just move the slides, and we already answered that poll. So here's some other topics that we thought of sort of addressing as we think about, what we might do to support you going forward. And put this up on the screen. And Charles, I know that you also had were very interested in what other folks what platforms they might be thinking of. So one of the responses, about 2/3 of you, or I'm sorry, a little over half of you were interested in a forum. So wondered if there are some of you that are using forums that you really like, and anything that we might think about using as a way to connect all of you through a forum. Another sort of question to answer in the question box as well.
So we want to make sure that the last poll question was very telling, and we want to make sure that we are providing a forum that actually works for you in the way that you do your work. So we're interested in hearing your answers to these questions. These are now getting down into the weeds. What platform, software, other tools do you use in your work to address ongoing and emerging needs for producing and sharing information with collaborators? I think that's there are a lot of things out there that people can use to collaborate, and we've all experienced all of them in the last 3 weeks. So what are the ones that you can use? What are the ones that you don't like? What are the ones that not work for you? And how would you like to engage for information sharing? And then we want to revisit this question again. It's been a couple of weeks since we asked it before and we showed those results at the beginning, but now having thought about it and talked about it a little bit more, what would you like to learn about right now? What is the burning thing in your world that you need to get information about, you need to get learning about? And then follow up later, what are some topics you would be interested in exploring a little bit later? And then the final question here that we'd like to get some response to is, what resources do you wish you had? And I think we've got, looking at the clock, we don't have a lot of time, but we have time for maybe 1 or 2 hand-raising questions if there's somebody out there that has those. And by the way, we are going to capture the typed questions. We will make those available to the group later as we'll circulate those so that you can see everybody's answers as they were coming in. But if there's somebody that wants to just jump in and maybe kind of comment quickly on these 4 questions, we do have a couple of seconds to do that.
One of the things that was sort of surfaced in the questions is the WhatsApp. I wondered if there were more of you that are using WhatsApp.
And I didn't think about this before deeply, but we've heard from some people recently that their IT department blocks certain technologies. So I heard somebody recently say that they're not allowed to use Zoom anymore for whatever reason, or there's somebody else that's not allowed to use fill in the blank. If there's something out there that you're not allowed to use, we'd like to know that as well. So.
Right. Zoom is not allowed in multiple states right now because of the security issues. So they are instructed not to join to Zoom meetings.
Yeah,
and I'm reading.
Yeah, I see one there that they're only allowed to use Cisco WebEx. That's interesting. Good to know. Well, actually, we probably ought to move on because we are, in fact, running out of time. But if there are some of those specific things, drop those in the questions bar and we will capture those and circulate to everybody. So I'm going to turn the time back to Candace.
Yep. So next steps. As we think about next steps, we will be taking your poll results and making those considerations. As Norm and Alex said, these are very telling and very helpful for us as we think about how we might support you going forward. We will collect all of your responses and reach out to you to let you know what other information and resources that we can provide for you. As we're closing out in these last few minutes, if you think of other topics that you haven't already sort of shared or things that we might do to support you, I would encourage you to put that into the questions box so that we can capture that and build out our next series of sessions for this learning community. In this last minute, I am going to turn it over. Oh, I'm sorry. As Shule mentioned, here's the list of contacts. If you have any questions, this is Norm and Charles, Shule, and my email address. Feel free to reach out to us with any questions or topic ideas. We're happy to take those. And I'm going to turn it over to you, Norm, to sort of close us out and let us know about the survey that may follow this.
Yes, thank you. Just want to make sure I was off mute. We are so excited to have had this opportunity to help you and to serve you, provide things that are useful to you. And we do hope that this is the first of many users group meetings or users group forums. So by the way, we do invite you, of course, send any of us an email with suggestions as to how to make this more effective for your work. We understand that people don't necessarily have a lot of time to be on a lot of meetings. So we do want to have those to be effective. There is going to be a very short survey going out after the meeting. We captured almost everything that we wanted to in the polls. We do have that data captured and we'll make that available to you as well. But there's a very short survey at the end of the meeting. Make sure that you just fill that out, click the answer so that we capture that at the end of the meeting as well. And with that, we are about out of time. So we're going to be one of like the first meetings to ever end a minute early.
Norm, one thing I just wanted to mention also is you're thinking about questions and ways that we might support you. If you feel like your organization is doing something you'd love to highlight your organization, that might be an opportunity for you to do some collaborative sharing, and we'd love to work with you on that as well. So please let us know if there's an opportunity to do that.
Right, like Nicole did a great job today with Florida. So if there are other examples that we'd like to collectively think about and help each other, that will be great for next session.
Thank you, Shule. Good afternoon, everyone, and we will be in touch soon.